So what's your name?
Peri Gray. So Auntie Ella was a woman who very holistic, very spiritual. She just eats like nuts and like raw fruits and drinks water.
Mm.
But you would think she'd be healthy. She wound up getting ovarian cancer. So they took her to Aston, and they just heard about him on the radio. They didn't know him from Adam. And they went. I don't think they brought Auntie Ella in to see you. They came in themselves.
No, I never met her.
You never met Auntie Ella. So they came in and I guess brought her diagnosis and everything and told him what was going on. And he gave them what medicine to take. And within like 6 days, she was eating solid food. She was up. And now she's like walking around like nothing. The tumor shrank and everything.
Wow.
So from that experience, when the doctors told me that the baby possibly has, this chromosomal abnormality, their first thing was like, you need to go see the doctor in Queens. But they never call your name. They just say, you gotta go to Queens. You gotta go see this man. You gotta get the herbs. I'm like, all right. I was adamant, and so was my husband, about not getting rid of this child. Just because you showed me a piece of paper with a number, I'm supposed to abort a child?
Right.
Like, that just didn't make any sense to me. So fast forward, my sister-in-laws, they dragged me to him. So we talk. As we're talking, he's writing down, what formulas I should take and telling me and blah, blah, blah. And I'm just like, okay, I'm nervous as hell because, he's telling me I've never done this before on a pregnant woman. I've never worked with this type of case.
With Down syndrome.
So that's not making me feel real confident. So now I'm like, oh my God. And you could ask Beverly. We were like going back and forth in the front, like, oh, what do I do? And, on all these products.
Mm-hmm.
So then I told her, I said, somebody has to be the first. I can't sit here and do nothing. So I started the medicine. Then after a couple of days, I just started feeling good. Face had a lot of acne, just feeling tired and sluggish, no appetite. I started taking this. Now I notice my metabolism is kicking up. Like, I want to eat.
Mm-hmm.
My face is clearing up. My eyes got brighter. My sister-in-law said I had looked malnourished. My color was off. So everything just started coming back. And I just started feeling good. So here we are, 2 months later?
Mm-hmm.
6 months pregnant. The baby's growing. The baby wasn't really growing properly. She's still a little underweight for how far along I am. But at least now we're out of that danger zone. Because before they were talking about, we may have to take her early and blah, blah, blah.
So are they saying the baby looks healthy now?
The perinatologist felt that most babies with Down syndrome have heart defects. So they were like, you should go get the fetal echocardiogram. Doctor comes in, takes his own look. And he's like, I don't see anything wrong. The baby's heart is fine. Everything's perfect. Basically wants to monitor the baby's growth every couple weeks via ultrasound.
Mm-hmm.
So they just go through all the organs and they just make sure everything is okay. And the baby is generally healthy.